Hello, good afternoon, good morning, good evening to everybody who's here on the video, and thank you so much for watching my YouTube videos and liking it, sharing it with your friends, and it makes me happy and motivates me to make more videos. Okay guys, thank you so much again. It really means a lot to me. Today video we are going to talk about all the truth behind the nursing. What do we do here in as a nurse? What is the part of the job? I mean, in some countries there are different things the nurses do. Here it's all different, so I would like to highlight those things to the people who doesn't know, who are still in their countries and then thinking about moving to the UK. All right, so we will talk all about this today. If you are interested in this topic, stay tuned, watch the video till the end. Thank you. First thing first, I want to make it clear. I'm going to talk about my experience. I'm a general medicine nurse. Okay, if you work in the ITU, ICU, cardiac ICU, or emergency A&E, or outpatients, daycare units, the experience for them would be totally different. Okay, so as a general medicine nurse in the ward, what is our responsibility? What are the things that we do as part of the nursing job? So I just want to make sure that you get it in your mind. It's not for everybody. It's not all over the hospital. If you work in A&E, if you work in daycare units, outpatients, and things like that, the routine would be different. So as a ward nurse, let's say general medicine, cardiology, respiratory ward, or cancer ward, all these wards, what is their routine and what do we do here in the NHS as nurses, our daily routine, and I will discuss all this in this video. Okay guys, so a few months ago someone commented on one of my YouTube video asking that do we clean the patient bums? The answer is yes, we do that. If someone open bowels, if someone pass stool on the bed or in the commode, you need to clear it up. Okay, so we clean it. If someone passed urine on the bed, we clean it, we clean them, we change their sheets. It's part of the job. Okay, and if someone is independent and mobile, for sure, of course they can go to the toilet, they can walk to the toilet, they can do it by themselves if they can. If not, the nurse or the healthcare support worker, whoever is available, would go with them and clean their bum. It's normal, and we do it on daily routine, on daily basis for each and every patient. Okay, if they're independent, they can do by themselves, well and good. But if your patient needs assistance of one, either nurse or the healthcare support worker has to go with them. Okay, if you're working in the elderly ward, most of the time they are not able to manage it. They won't be able to do it by themselves. So you as a nurse or the member of your team, your healthcare support worker, would go with them, help them with their daily activities, whatever help they need. Okay, so the first thing is, if they are independent mobile but they need little bit of assistance while toileting, while they're using commode or toilet. The second thing is, if they need assistance of one, as I said earlier, one person has to go. The second thing is, if they need assistance of two. What do I mean by that? Assistance of two means two people needs to help that person to get into the commode or to the toilet. Okay, so you and your support worker would help that person, that patient, to get into the commode and clean their bum. If they open bowels, if they wee, you need to clean it up, put them back in the bed, safe and sound. Okay, because if they need assistance of two, maybe they are high risk of fall, maybe they have hypertension, postural hypertension or something like that, or maybe poor mobility. If you have to use any mobility aid for them, if it's if the person is assistance of two, means two person needs to help them, or whether with the use of device, mobility aid, steady or rotunda or hoist, whatever, you're gonna use them and help that person to do their business. Okay, there are also patients in general medicine, the ward I work in, they are mostly elderly patients, 50 plus or 60 plus. Okay, and then sometimes they may need assistance of three. Then you need to call someone. If you are two person in your team, then you need to call someone to help you guys to help that person. Okay, and then also, as I said earlier, with the aid of mobility aid if it's needed, right? And then I know when I was a nurse back home in Pakistan, we don't do any personal care in Pakistan. I mean, the relatives or the sport workers, healthcare assistants, they help us with the washing and dressing up the patients, or the relatives, they help us. So it's most of the time I graduated from a government hospital, and it was very busy hospital. So our jobs, like our duty that time was do the OBS, fluids, IV fluids, medications, dressings and things like that, but not personal care. So here we do patient bathing on bed or on chair or in the toilet. Okay, same process as I said earlier. Assistance of one person has to go with them. Assistance of two persons has to go with them. Same for personal hygiene care. So we wash the patients every day. Okay, you got 10 patients, you need to wash them. After doing the drug round in the morning, your sport worker would help them with the breakfast. After that, you wash them. Okay, bed baths, we give bed baths, we give them bath on the chair also with the towel and wipes and all those. And if they want to take a shower, you need to go with them as well. So this is called personal hygiene. Okay, and also when the personal hygiene also includes the brushing, oral hygiene. So we as nurses or as healthcare support worker help them with these things. Okay, you need to provide them with the bowl. If they can do it by themselves, give them wipes, soap or a brush or something to pour the water in, and tell them that these are the things you're gonna wash yourself, and I'll help you where you need help. Okay, and also for the oral hygiene, if they wear dentures, they need to remove the dentures, clean the dentures. If they can do it by themselves, well and good. If they can't, then you need to help them with those things. All right, so we do oral hygiene care, we do personal care, we help them with the number one and number two. Okay, so just make it clear in your mind, you'll be there to do everything. Okay, the next thing is also, if someone vomits or poo on the floor, who's gonna clean it? Either the nurse or the sport worker. The domestic workers, they don't clean it. Okay, it's not part of their job. They will do the cleaning after you have done it. I mean, they'll clear it up, they'll clean it, you will clean it, you or the nurse, whoever is available on the spot. Okay, whether it's a doctor or a sport worker or a physiotherapist. Doctors sometimes they don't help, but physiotherapists they do, they are really good. So if it's a physiotherapist there and patient open bowels, if they are trying to mobilize that patient and patient open bowels, they will do everything. Okay, if you are there as a nurse and then you see them that they open bowels or their bed is wet, you will be there to help them. You will clean their bed, you will make bed for them, you will clean them, you will put new bedding and everything. All right, just to make it sure. Also, if someone vomited, you will be the one to clean it, and then you call the domestic workers to come and clean afterwards. In the toilet, like for each department, like if I'm in one room, I have 10 patients there or 6 patients there, they would have their own toilet. Okay, they will go there. And then if someone open bowels on the commode, you will be the one, the clinical staff will be the one to clean it, and then you need to call the domestic staff to come and clear it up. Okay guys, I know that it's difficult, it's different for in some countries. Back home in my country we don't do anything like that, but I remember when I worked in cardiac thoracic ICU, there we would do bed baths, because I was working in cardiac thoracic ICU in doctor's hospital. After bypass or valve replacement or something, we would give them a bed bath, but with the help of the nursing assistant. But here, if patient is assistance of one, you are the nurse, you will do it by yourself. But if it's assistance of two person can do it, because you are a team. 10 patient, 1 sport worker and 1 nurse. 1 sport worker cannot do everything. Okay, so after you have done your drug round, you need to help them, ask them where they need the help, if all the wash has been done, or if they want your assistance with something. Okay, if they have done everything, if you got lucky enough, if you are lucky enough and you got all the independent mobile patients, then maybe they don't need your help. Okay, but if you got like assistance of 2, assistance of 3, then obviously they would need your help. Okay, so these are the points I wanted to make clear, because everybody sometimes they just message and YouTube asking, do we clean the patients, do we change diapers? So elderly patients, the next thing you need to remember is whether they are continent or incontinent. What does that mean? Continent means if they can tell you that they need to wee or they need to open bowels. That means continent. Okay, if a person can tell that I need to go to the toilet, I need to use the commode for wee or bowels, then well and good, that means continent. Incontinent means they don't know if they are going to open their bowels. Incontinent also means, so if they are incontinent of urine, means they won't know if they are passing urine. They won't be able to tell you. So every time you go there, the bed will be wet, the bed would be wet. Or if they are incontinent of bowels, they'll open bowels on the bed and you won't know. So if your patient is incontinent, you need to go and check them frequently. If they are on turns, if they have pressure areas, then 2 hourly turns, and then each time you turn them and they are incontinent, you can check them on the same time. If they are on 4 hourly turns, you go there, you turn them, you can check their bums also on that time if they are continent, just to make it sure they don't get stay wet and develop pressure ulcers. All right, so this is the most important thing also. If they are continent, well and good. Incontinent, you need to go and check them. Continent of urine or bowel, you need to know your patients. So you have 10 patients, you need to know each and everything about themselves, about them. All right, sorry, what else? I think these are very important things. And also, so we have made it clear that you will be changing the diapers, you will giving them the pads. We say pads, not diapers. So you will be changing the pads, and they say incontinent pad, or for elderly, it's very common for them to be incontinent. So we use the sanitary pads, not the sanitary pads, the big ones. Okay. And then you will be the one doing that. And also, as part of your nursing job, you will be doing the drugs, OBS, ECGs, all other procedures that you all know. Okay, so this one is just additional. Oral hygiene, personal hygiene, you need to monitor their bowel habits, how often they're going to the toilet, if they are urinating more frequently, if when they open their bowels last, So we have a paper called intentional rounding, and you will record there. If they open their vowels, you're gonna write it there. If they V, you're gonna write it there. And then also for those 10 patients, there is your part of the job that you need to know when did they open their vowels last. If they are constipated, because for elderly patients, if they are constipated, they'll be like moaning or not happy or irritated. Okay, so you need to know if they are constipated or not. So also sometimes if you give enema, nothing happens, they didn't open the vowels. If you feel like they're constipated, you may need to do manual evacuation. All right, so just keep in mind, you'll be doing everything. So nursing में क्या क्या करना पड़ता है. Okay, just remember, just keep it in your mind, guys. All right, so that's it for today. If you like this video, please share it with your friends, and then share it with the people who are aspirant to come to UK, who wants to change, make a change in their life. Share it with your colleagues, and then give it a big thumbs up if you like it. And then also let me know in the comment section, was it new for you to know this one, or you had already known this? Just let me know in the comment section, guys, if this video is gonna be helpful for you. Please always make a comment. I always feel happy to reply to you guys. All right, okay, thank you so much. I'll see you soon in the next video. Take care. Bye bye.